Hey there, I'm Gilad Barash, and welcome to Who's Your Data, the podcast that deals with how data influences life and how life influences data, the human side of data analytics. Did you know that the US has one of the highest, if not the highest, maternal mortality rate in the United States? This is especially true for women of color who suffer from lack of access to quality care and not being taken seriously. Join me for a conversation with Mohamed Kamara, founder and CEO of InovCares, a behavior change platform for women, particularly women of color, that provides access and treatment to culturally sensitive clinicians. Their app combines real-time metabolic health data gathering with telehealth, computer vision, artificial intelligence, patient engagement rewards, and a sense of community. We discuss what it means to be culturally competent and how they use data and AI to provide services such as virtual ultrasounds from home, post-partum care, and a community of online support. We talk about data privacy and what it means to disrupt the healthcare space, an industry that is so ripe for disruption. Mohamed also provides insight on his experiences as a Black entrepreneur and advice on navigating that space. So let's get to the interview. Okay, Mohamed, welcome to the Who's Your Data podcast. Thanks for coming on.
Thanks for having me, Gilad. I'm looking forward to this conversation and just hearing more about how we can make healthcare better.
Before we start, I wanted to ask you a little bit about kind of your background and what was the sort of motivation for this app.
In healthcare, mostly, it's either you, especially a startup, it's either you sit somewhere, you come up with a problem, or the problem finds you. In my case, it was the latter. The problem found me. My sister was giving birth, her fourth child, which did not go as smooth. It led to a complication. She died of pregnancy hemorrhage. So this is her fourth child. When she passed, I had a ton of questions. Why was her death so sudden at the age of 35? This is a young woman that was healthy. There was no clear indication of pre-history of diabetes and other comorbidities, especially cardiovascular conditions that could have led to complications. There was no history there. So dying of pregnancy hemorrhage, which means that bleeding profusely during delivery and not being able to, the doctors and the clinicians not being able to stop the bleeding, which led to her death. And this happened in my home country, Sierra Leone. Strike two then happened with my aunt in Columbus, Ohio, who passed during childbirth as well. This was her second child. Her first child were twins. Went smoothly. The second one, she died of preeclampsia, which is a condition of hypertension during pregnancy that's oftentimes not identified. This is a condition during pregnancy of having elevated blood pressure, which left untreated can lead to complications during pregnancy. And so her pregnancy led to her death in Columbus, Ohio. The son survived. So my dad and my stepmother became caregivers for those three kids. Now the twins earlier and the son that survived. And then I became caregivers for my sister's kids in Sierra Leone, support them financially. My mom oversees them. From those perspective, I knew then that there are problems in the States, which is 7 million women are living in maternity care deserts. And the disparities are very alarming. So 7 million women, they're living in maternity care deserts. 8% of those women are living in areas where there are no OB/GYN physician, little to no OB/GYN physicians. And that is very alarming. And so we wanted to create a technology that, one, improve access to care to the right clinicians, right? So we refer to this as culturally competent physicians. These are physicians that take the time to understand the unique needs of the patients they're seeing and their demographic, the environment that patient comes from. Well, that's how the technology was formed. It was from a lived experience to really improve access and as well as education and other community engagements for women of color.
I see what you're saying, that sometimes the calling can find you. It's amazing that from that tragedy, you're developing something that will impact millions of women. And so can you talk a little bit more about what that means to have a culturally competent OB/GYN and what's the impact on maternal health for women of color for that?
Yeah. So there are clearly noticeable differences when a woman engages with a physician who listens to their need. Um, a physician who takes the extra step to understand that uniqueness of that woman without silencing or dismissing their voice. When you silence and dismiss a woman's concern during pregnancy, you leave them very vulnerable to not trusting the health system. That woman doesn't want to go back to seek that care from the hospital or that clinicians, whether that is an inpatient at the hospital when they're delivering or outpatients when they're doing their prenatal checks, right? It silenced their voice. And I'll give you a key example here. Matu was one of our patients who was experiencing infertility, had an OB/GYN physician who was being very dismissive of Matu's needs. Matu is a 33-year-old nurse practitioner by trade, lives in Columbus, Ohio, trying to give birth and experiencing this infertility, but had a physician that wasn't culturally competent, being very dismissive of Matu's need and her voice. So she wanted a second opinion. She found those then online. And that second opinion was being connected to a physician who understands her unique needs and her environment. And this is Dr. Alwoody, who then walk her through during that 30 to 40 minutes conversation on what's really causing her infertility and how to actually improve and get pregnant, right? Making her understand that it is not her fault being infertile. It's not her fault. It's not the husband's fault. This should be it should be more of a relaxing environment for them both to try, because infertility itself can be an influence of the husband, right? The sperm.
Mm-hmm.
So the husband has to have a healthy sperm, and then as a result, in a more comfortable environment, not too much pressure, the cycle of the woman, when the woman will have certain time of their cycle, will help improve them getting pregnant. So they have that kind of dialogue, and then he also then prescribed prenatal vitamins, which we then sent to Matu's home. And then 2 months after, she checks as a physician, I'm pregnant.
Oh,
And
wow.
9 months after her son John was born alive and well. So that's the impact that a culturally competent providers can have in the life of a woman and change the trajectory to birthing successfully, getting pregnant and birthing and bringing a healthy baby boy John into the world.
So you stress that it makes a lot of sense, not only that there is a maternal health care desert in a lot of places in the United States, but it's not only just access to care, but access to the right kind of care, to quality care that is consistent with, like you said, demographics and culture. The app that you provide, can you talk about what services it provides and how many people does it service today?
Sure. So we're impacting 25,000 women, and we provide services in primary care, mental health, and women's health. And the reason for that is we want to really provide services that treat the whole person, the whole woman, and their need. It's not just a subset of that woman, because a lot of the issue around maternal mortality is even after pregnancy and after successfully delivering, that 12 months, right? Conditions can lead to complications even during that time as well. And then there are some moms that do experience anxiety, postpartum depression. You probably have heard that word. And during that time period, it's very critical for them to have the resources, the financial resources, the educational resources to be treated during that period of time, and to have the support network. And so for us, we've created not just training the women, connecting them to the right providers, right clinicians like doulas, midwives, but as well the right type of clinicians to support them during if their mom do experience like mental health condition, anxiety. So get supported with a clinical psychologist or primary care physicians as well. And then making sure that they get supported with a network that's cheering them on. So this is a network of all the moms that we refer to as a health tribe. There's some moms that say a mom that has experienced pregnancy loss. They will have a support group that they can connect to, and they will share materials among each other. And then if there are more personal things that they can share among each other, they will post in our Q&A board that our physicians go in and answer those questions. Again, it's not just the connection point to the right clinician. It's also the support network and the education that these mothers need.
Okay, so it's also kind of a little bit of a social media kind of social support network that they can talk to each other. One of the services that you provide, I read, was virtual ultrasound. Can you talk a little bit how that works, just out of curiosity? How do you do an ultrasound from home?
Yeah, that's a great question. Right? Virtual ultrasound really can help prevent stillbirths. And the reason for preventing stillbirths is making sure that that baby is healthy and doesn't die. And the mom finding out that they've experienced a pregnancy loss, the baby is dead as a result of that. So what the virtual ultrasound allows is for the mom to be at home with the support of an ultrasound technician or midwife to be able to, in real time, get the measurement and the fetal of the child inside in the movement, and be able to share that imaging with an OB-GYN at the other side out in a hospital or at home. And they can see in real time that image of the baby and the health of the baby, and be able to try to tell the mom this is how healthy the baby is with that ultrasound. So this ultrasound is then connected by the mom at home.
So is the ultrasound technician coming to the patient's home? Okay, gotcha.
Correct. This is really to support the patients in order to have a trained ultrasound technician to be able to conduct that, right? Now, if the mom is well trained and then during that conversation, they can actually possibly be able to conduct it themselves with a OB-GYN physician that can walk them through it. But oftentimes, because of how the levels of the reading itself, we usually recommend to either have a trained ultrasound technician to be sent to the patient's home.
Is it something that you connect to the phone, or?
It is then connected to the phone. So the ultrasound itself is placed on the mother's belly, and then capturing the fetal and the movement of the child inside. And then that imaging is then shared via our app to the physician, and then he can do the reading and tell the mom how healthy the baby is, and then say, yes, with comfort, the baby is healthy, the baby is moving, and there's no all the signs that may lead to stillbirths. That's another component that's super important for us.
Okay, so let's talk about data. How does data get used in this context?
We know that 60% of maternal mortality, pregnancy-related complications are preventable. We know those facts, right? 60%. Based on CDC and other governmental organizations. If 60% are preventable, and majority of that prevention is around cardiovascular health condition. So these are conditions like diabetes, hypertension, that are easily preventable. Like diabetes, if diabetes is left untreated, it can lead to pregnancy complications. So what we do is we collect data around the cardiovascular conditions that affect moms during pregnancy. And then we let them know, here is where your true overall health is. Here are the recommendations for you to stay healthy for the sake of yourself and the baby. These are the things that you need to be doing to stay healthy. Part of the data that's collected, one of that data is BMI. Again, it's not your traditional BMI, because that sometimes doesn't account for the demographic of that patient. So It's a corrected BMI. And that corrected BMI itself is patented by NASA. So we did a patent transfer technology in it. And the corrected BMI then accounts for the true metabolic health of that patient and their demographic as well. So a mom of color may have a high BMI, but they don't consider the mass of that mother. Even yesterday, we were discussing this with my girlfriend, who is a clinician herself, on the problematic of BMI. And she was telling me her BMI, the density itself is not just, so for her BMI will say, oh, she is obese. And that's not true. She has muscle mass. And so that has to be accounted for. Even myself, most of the time, if I go get my BMI, they traditionally will tell me that I'm obese. I don't think I am, but because of my muscle mass itself, right, that it takes account, so that's the reason why it's corrected BMI. So those are the level of data that approximate accuracy of that true measurement of that mom during pregnancy, as opposed to letting them know, hey, your BMI is at this, which is problematic and frustrating, especially for people that come from different demographic.
Okay.
And so that data itself, by the way, that data is then taken and provided to the physician before that consultation happens. So they have a precursor of the true health of that patient and what they've been doing beforehand before they even have that first initial consultation with that OB/GYN physician.
All this data that you collect, when I think about that, it sounds like it's a great source of data to be used somehow. Would you do anything with it? Is it something that you could publish it in a way that can be helpful to the industry, or use it in some sort of feedback loop to improve care? Do you actually go back and look at that data or utilize it for, especially when you look at, like you said, outcomes of treatments that were helpful, and then looking at that historical data?
Yeah, so clinical in terms of clinical trials, right, and the efficacy of the technology itself, then the data at the more high level can be used, not at the patient level because of privacy concern, right?
Yeah.
So we can provide that at the aggregate level and saying these are a number of patients that we've treated that are in the controlled environments and uncontrolled environments, and publish that data itself that can be effective and useful for people in our space. So yes, it can be collected, but it's mostly used for research basis and be able to publish that data itself. So in clinical trials, to ensuring that the technology is super effective for prevention of pregnancy-related complications and the conditions that affect mom during pregnancy.
In general, one of the big concerns for consumers using apps and sharing data nowadays is privacy. And in the healthcare space, this is especially important. And so how do you think about privacy as it relates to the product in terms of, I assume patients, opt in and share their data, but is there disclosure around the kind of data that's being used, or what else do you think about when you think about privacy?
In building a technology of this kind in this space, everything has to be HIPAA high-tech compliant. So it's not just the app itself, how the encryption in the app, the biometric data itself, all of that's encrypted. So it has to be HIPAA high-tech compliant in order for you to be even let in for Apple and the Google of the world to be able to allow you to publish your app on the App Store. Secondly, it needs privacy of the data is controlled by the patient. So even the health assessments that I was referring to, the patient share that information with their doctor. So patient control that sharing, right, ability. It's not pulled from like the doctor being able to access it, as opposed to we put the power in the hands of the patients. We believe truly in that. Other in this space it's usually on the other side where electronic health records data, it has to be then consumed and pulled from the electronic, then shared to the patient. While in this case, it is patient has their data, they opt in to share that data with that physician. The power of patient-centered care is we really truly believe in that. And so patients share that data with the physician before that consultation happen. Again, it's not the other way around. Mm-hmm. And then if data is shared of any kind, it's all on the aggregate level for research purposes. This is also listed on our privacy and terms and conditions as well.
I like the way that you framed it as patient-centered care. And that brings me to something else that I was really excited to ask you about, because in general, healthcare is definitely a space that's ripe for disruption. I personally think there's two industries that are, really have not had the level of innovation, at least not as the experience, and that's healthcare and travel. I think, with healthcare, you still have to go to the doctor, you still have to fill out the forms. Every time you go, you still have to, and it sucks. It just sucks. The experience, right, with everything that we've gotten accustomed to in the 21st century, where banking is immediate online and buying tickets and everything. You don't have to see anybody, you don't have to talk to anybody, you get everything done, except for when you're sick. Then you have to go to the doctor, you have to wait in a waiting room, you have to fill out the forms, the machine is broken, and then you have to go get your drugs from the pharmacy. It's just very 20th century. And travel also, the whole it doesn't seem to me that there's been innovation in flying for the last like 50 years, at least not from the experience. Like, okay, maybe the seats are a little better, maybe you get better movies, but overall, it still sucks. So as somebody who travels a lot, it sucks. In the healthcare, let's go back to healthcare. Like I said, it definitely is ripe for innovation and disruption. And it sounds like, two big things that you do, for example, whether it's like the ultrasound from home where you don't have to go into an office to do it and go through that entire manual process, as well as, like you said, sharing your data with the provider rather than having to go in and fill out forms constantly. So it sounds like, that's definitely a place that is ripe for disruption. And so what are your thoughts about that and the future of patient care, especially in light of, it does seem that there is movement in that industry now between Amazon buying One Medical and Walmart getting into health. How do you see the space changing in the near future?
That's a great question. Patient-centered care is thinking, as you said, you're thinking through the pain points of that patient at every interaction with the health system. When the patient is at home, they're sick, how do you make it easier for them to get the best care? They have a common cold or flu. That patient can actually be treated virtually if they have a common cold and flu. That's what some of the conditions that are treated by telehealth. And part of that is for us, our patients will go in, they will, as they book, they go through the booking experience, see less than 60 seconds, they're in the app, sign up and in the app. They go through the booking experience itself of finding a clinician. And after that, they either will pay or they'll pay with insurance. And then they will answer intake questions. These are the intake questions that you fill out when you're in that in office visit, right? And that is so frustrating for patients because why can't you make that digitized? So we've digitized that experience. Those intake questions are also filled out as part of the booking experience. All seamlessly happen within 1 or 2 minutes doing that. And then the physician gets a confirmation, someone is booking an appointment with you. These are their conditions. Here's data that they would like to share of how they're feeling. Then you guys do a video or message consultation all at your home. When the physician finds out that, hey, you have they've looked at your chart, you have some conditions on, say, a common flu, they then can prescribe medication, which we then send to patients home directly. I'm not sure if you heard with Matthew's story, how we were able to send prenatal vitamins to her home. Mm-hmm. So we send that directly to the patient's home. And then in the case of Matthew, was a beautiful baby boy. John was birthed from that. So you are at home there now. For you, in your case, if you have a common cold, you'll be treated with antibiotic that's going to be sent at home, and you don't have to see that doctor in person. And so that helps you with transportation. It helps you with not getting sick by going into the office or hospital that's already have sick people, really sick people, which you just probably have a common condition. Now, in the case of women's health, there are things that need to be done in person, right? But at least the intake forms and all those stuffs are taken care of beforehand so that the process is very seamless. And if that mom do have an issue with transportation on the app itself, we allow for our clinicians to book right for those mom to and from. So if a mom that doesn't have transportation, they can then have someone pick them up to take them to those in-person prenatal visits. So in the case of One Medical and the likes, it's thinking through the journey of that patient and the frustrating part that stops them from access to care. So meaning, what are the obstacles that will stop them from getting the best patient-centered care at the least price and at the best quality? So thinking through that journey, it makes you create better products for that patient. And the same here in the case of One Medical, Amazon purchasing One Medical, they're purchasing actually the network, right, that they've created. So it's the network of doctors that are within that is what really Amazon has purchased. The technology maybe that they have created is maybe it's more of an added bonus, but it's really the network. So when you even go in and sell, you partner up with the organization or you sell to another entity, you're selling the network of clinicians that you've created over time. In our case, like culturally competent network clinicians is what that buyer is buying into. And of course, the added bonus is your technology that makes it all happen.
With Amazon having the delivery infrastructure that goes with the network kind of makes it, like you said, the sort of patient-centered 360-degree, everything that they need, even in areas where we're privileged to have access to care. I know, friends that don't want to go to the doctor because they just know it's going to take hours and they just don't have time for it. Having a way to streamline it. And yes, there are certain things that you have to go in for sure. But being able to streamline processes that you don't have to go in for is amazing. And I really think it sounds like you're really at the kind of cutting edge of that disruption in healthcare, which I think is super fascinating.
Yeah, it's built with physician and other clinician in mind, built with patient in mind. First is the experience of that patient, as I alluded to earlier. Also building with the clinician in mind. I was privileged to build alongside a clinician. So when we even launched, I was seeing 20 to 30 patients with clinicians and see how they interact with that technology as well as their existing EHR. Why is that important? That is crucial because of the fact that clinicians are human beings and they have family and loved one at home. And when they go home, you're now requiring them to do additional charting, which is taking time away from their loved one.
Right.
Which causes physician burnout. And so we're building with a clinician in mind. You see how they interact with your technology and the EHR. You create that seamless process. So when a patient books an appointment in your app, it then gets alerted into the existing EHR without making more additional work, creating additional work for that physician workflow. It creates happiness for the clinician, higher adoption, and then they can then share that with their patients, right? As opposed to when you, as a technologist, as a company building with, I'm just going to build for the patients and forget the clinicians as well, which are the people that actually touch that patient on a daily basis, and forget the impact it creates for their family and their loved ones, which is physician burnout, which is a real thing. So you've got to keep that in mind as well as you build in this space.
Doing it patient-centric care and clinician-centric care rather than focusing on profits of medical insurance companies, I mean, that sounds revolutionary.
It's why I came in this space. And of course, the payers, you cannot forget about them as well, like, because they do care about quality care and they have their measures and they have their reimbursement and the payments, right? So you do have to walk alongside them, and which we do. And so if a payer is your audience and they want to walk alongside with our network, please, we'd love for them to reach out, because then we can actually support their patient panel that they have and be able to provide this network of culturally competent providers that listen, that treat patients with dignity, and provide the best care to them based on their demographic.
That makes a lot of sense. Okay, now what can you do about flying? Can you fix travel?
I love to fly.
Get to the airport 4 hours ahead of time, sit there in uncomfortable seats, eat their crappy food come on.
That is a great question. I wish we have better travels, but there's definitely a need for improvement in travel. I am on planes all the time and I'm asking the same questions as you. Why do we have to wait in line for this long? And don't even consider flying out of Atlanta. I fly out of Atlanta and it's a nightmare at times, but good Lord, there's so much room for innovation in this space. And I hope those that are listening will find solution
I hope so.
to improve and innovate.
I do a good deal of flying in and out of Atlanta, and my rule is I'm like first or second flight out in the morning. I do not wait till the afternoon or evening. I know that there's a direct correlation between how late the flight is and how much it gets delayed or canceled. So that's my rule.
See, you're a smart man. They need more smart people like you in those rooms that are decisions being made about travel. In my past life, I worked for a company that it's more like airline travel. They send high sensitive information like blood transfusion, right? To get that to the patients before they die. So they transport those things. Part of that is you have to be really considerate of the time limit it's taken from when you get the blood to the patients in the hospital very quickly. So I've seen some innovation in this space because of that first-hand experience, and then of course calculating the numbers around that. Being a finance person, you have to calculate even how much time it's going to take, the miles, right? So happy to have that chat as well.
Yeah, you know what? We're gonna have to have that chat one time too. I can't imagine. In my mind, I'm seeing, okay, you're rushing with somebody's blood, and then you get stuck in a 2-hour TSA line, and you're like, damn.
Yeah,
yeah. Have clear or TSA pre-check.
Exactly. And this is why, yeah, you fly chart, like there are different types of planes that you will fly for them that, but that's a conversation. That's a whole new episode.
To the extent that there are potentially many opportunities to address gaps in representation and inclusion the way that you have with this innovative app, can you talk a little bit about what your experience was as a Black entrepreneur trying to address such a gap, and whether you would have any advice for budding entrepreneurs that are looking to do something similar?
There's always a question on reflecting, right? You build from lived experience. It gives you empathy of the user experience, both in our case from the patient, the mom, and their loved ones that interact with the tech, from the physician. Because if you build from that, you build from lived experience, and you create the workflow of that patient and that physician from an empathy point of view. That's usually the best entrepreneurs I've biased, because they're building from that lived experience. The other side of it, though, as well, at least in this space, if you're building in this space as a minority entrepreneur, there are hurdles you're going to experience. We had built the technology from ground up without any venture money. And then last year we did get some. And then this year, of course, as well, we've gotten some. We have new people on the cap table, like Andres Inouye, that's coming in on the cap table as well. But building in this space as a minority founder, it is getting access to capital is very, very hard. And you need to think through that it's going to be challenging. You're going to receive a lot of no's. But then there are also times as well that you receive some term sheets that are not the best friendly terms, and you have to say no to those, even though you're receiving some no's. So finding that balance, like, okay, I should take money from anyone. Don't do that, because every time you take money from an investor, it is a long-term relationship that you're cultivating, and they need to come with an added value beyond just the capital. It is a network they're gonna open. So even now, recently, we're taking a check from Andres Inouye, right? Our first venture check that we took was from a firm called Jumpstart Foundry. The second one now this year is from Andres Inouye, and for them is their network, right? It's what we're betting into, because they have invested in companies like Facebook and the likes. And so they've had successful track record of exit, that they've invested in founders that have exited or went IPO. Mm-hmm. So now that we're betting on Andres Inouye and their network, hopefully then we can utilize that effectively to close our $1.5 million round that we're raising. And so that's, again, thinking through being a strategic investor, right? Having a strategic investor on your cap table, not just taking any money from anyone. And even to the extent doing your research too. So I spoke to other founders that are taking money from them, and they validated that they were able to close their rounds because of their network that Andres Inouye opened, right? And even for myself, it's not only talking to founders. I even took that further. For me, I went on and did a search recently and see how they partner up with hospitals. They've been partnered up with a hospital down in New York. And for me, it's like I'm very proactive. I know that I looked up the CEO of that hospital, and then I hit them up yesterday, actually. And the CEO and I are connecting on Friday. People book some time on my calendar to talk about their relationship and then how we can support them. So again, you as a founder, be proactive, even in the midst of you getting the no's. Build as what gift that you have as a minority founder is resilient. They'll never take no for an answer, right? And that's at least my character as a person, because I've lived through a civil war, and no is nothing. Someone that's lived through bullets and fires. I'm getting no's from people is something that just shake off and move on to the next investor that I can actually the company that can actually build with. I hope that helps and answer that question. Really, mostly is resiliency.
Absolutely answers the question. That, first of all, like you said, resilience. But my takeaway from that, which I think is really important, is that the investors, it's not only them interviewing you, it's you interviewing them and making sure that it's a good fit in both directions. So what's on the horizon for you and for InovCare? Like, what's your next set of challenges that you're going after?
So we have this grand mission and goal to impact the life of 1 million women going through their birthing journey. And so what does that look like is partnership with payers, right, that have members that they've cultivated a relationship with, that they can entrust with us to take care of. So those payers are the critical people for our growth. And so a relationship with commercial payers, meaning insurance companies like United Healthcare or others in this space, Humana Health of the world, right, Centene's of the world, really cultivating those relationships. So if there are any that really want to have a discussion and see how we solve problem for women of color and ensuring that they go through their birthing journey with dignity and receiving the best culturally competent care, we'll love to have that dialogue with them. And so for us, our growth trajectory is partnering up with these payers and ensuring that we take care of their members, and as well as partnering up with community organizations like FQHCs, where this woman is going into to get supported in hospitals. So that's the trajectory and growth, and then ensuring that we close this round so we can hire more people to support our mission and actually have people that are mission driven, that care about improving the maternal mortality crisis for women of color.
If people want to learn more about the company or about you, about the app, where can they look for information?
Yeah, so we are on Android and iOS, and we've got a web version. So you can find us at www.inovcares.com. And you can reach us directly, myself and our company for my personal email is mkamara@inovcares.com. So it's M and then KAMARA @inovcares.com, or you can reach us directly to the company's email at contact@inovcares.com.
Sounds good. Well, Mohamed, thank you so much for sharing your journey with us. This was really, really great conversation.
Thanks so much, Gilead, for having me. This is fun.
Well, thanks for joining us today and listening to this episode. Please remember to subscribe, rate, and review our podcast. And if you have any questions you'd like addressed, send them to who'syourdadanow@gmail.com. That's who'syourdadanow, all one word, @gmail.com. Thanks, and see you next time on Who's Your Data?